Hi, this is Dr. Mark Sanna. I'm the CEO of Breakthrough Coaching and a multidisciplinary practice management consultant for 30 years. Welcome to the program. This program is brought to you by our friends at ChiroSecure, and we thank them for their support. This is part two of a two-part series in next level regenerative medicine protocols for osteoarthritis. I'm going to take you on a virtual tour of Regen Med procedures that actually take place in our Regen Med Academy Training Center here in Miami, Florida. We do these trainings as a group just about on a monthly basis, and you can come on down anytime for individual session of training with our amazing team here in Miami. Where we left off, we were talking about A2M, the first steps of the A2M of drawing the plasma, the first filtering off from the RBCs and red blood cells and white blood cells, separating those into that pure golden plasma, drawing off the first 5 cc's of PPP and setting that aside for heating in bioscaffolding prior to the first centrifuge process. And now we're at the process where we're about to concentrate our A2M. And that means we're going to use a specialized filtration system. You can see it laying there on the table in the screen on the right-hand side. And this is used to concentrate the A2M, to draw the A2M out of the plasma. It also helps purify the A2M by removing any other proteins, unwanted substances, in particular, the proteases that are the actual cause or perpetuator of osteoarthritis in the joint. Now, this is a big thing. Not a lot of folks know about A2M. They typically know PRP, they might know Wharton stem, but they skip oftentimes this important process. Again, we mentioned it's like having a termite infestation in your house and attempting to paint the house to make it look good, right? Those termites are going to keep eating away at the wood. Same thing, the proteases are going to continue to eat away at that good cartilage that's left inside of the joint, and that's going to perpetuate the osteoarthritis. And if you put PRP in there, if you put Wharton's in there, you're really not going to be doing the great job that you could because you have still got the termites in place eating away at the joint. You've got to stop that proteolytic enzyme, bind with those cytokines, calm that inflammation down, and then you can hit it with your regenerative therapies. So A2M traps the protease. It's kind of like a Venus flytrap. You see, it's got some bait regions that actually bind with the proteases. It doesn't destroy the proteases. It actually performs something called a death cascade. This is pretty horrible sounding, but it traps them in their structure. And that prevents the proteases from interacting with other target substrates. And so really, really important thing. Not only does it trap proteases, but has a high affinity to those painful cytokines as well. So let's talk about, now we've made our beautiful A2M and we've filtered it, removed the proteases and concentrated it down. We're going to now discuss joint injection procedures for osteoarthritis. We're going to talk about A2M, Wharton's jelly, Ozone, my favorite, some other adjunctive therapies like post-electronic magnetic frequency, peptides, post-HAB, post-rehabilitative therapy. And these are the things that make the big difference between wow and ow results with Regen Med procedures. So we mentioned bioscaffolding a little bit. What's that all about? Well, the first 5 cc's of PPP, platelet poor plasma, before centrifugation are drawn, and they're going to be gently heated while the rest of the plasma is put into the centrifuge. We're going to then mix that bioscaffolding after the centrifuge and after we've drawn out the proteases with the A2M in a process about 10 times back and forth, back and forth, back and forth. And this does some really, really important things. It actually maintains that A2M in the joint instead of from days, 4 days or so, up to a period of months, about 4 months. Same thing if you use bioscaffolding with PRP. It's going to keep those active elements, the growth factors, all of the important things that you're delivering in there with that injection in the joint for a multiple, much longer period of time than if you just put that in on its own. It's a big game changer. Don't skip bioscaffolding. Don't skip A2M, and add those to your practice. Super, super important. We always recommend double spin centrifuge. And there's a lot of controversy out there with double spin, single spin. Listen, there have been some studies that have done that show, for PRP anyway, when you use a single spin, it's about equivalent to placebo in terms of its outcome. When we're dealing with these products, whether it's platelets for PRP or A2M molecules for alpha-2 macro, it's all about concentration. And the double spin centrifuge process produces 9 to 12 times the concentration compared to single spin. So, well, you might get away using single spin PRP for soft tissues, aesthetic purposes. You want to go right to the big guns, double spin your PRP, double spin your A2M, and get the very best results possible. So these are heaters, a couple of different variations that you see up on the screen. They're a PPP bioscaffolding tool heater because it's the first 5 cc's of plasma that we're drawing off prior to centrifuging it. It's heated for about 10 minutes at 65 degrees centigrade in the bioscaffolding tool. It becomes a consistency of about toothpaste. And when mixed with A2M, it maintains activity in the joint for months compared to days. Here's a cooler. You want to cool the bioscaffolding after heating for about 5 minutes time in a cooler, or until it's cool to the touch before you mix it with the A2M for injection. We need about 60 cc's of A2M before mixing with the bioscaff prior to injection. And if you don't have enough from your blood draw, if it's a little bit low, you can actually mix it with something called BioOcean. BioOcean is an isotonic 9% solution. It's diluted to match the salinity of and mineral concentration of human blood plasma. So you can top off if you're 10 cc short, top it off and you'll be in great shape. All right, now that we've done our A2M, we're ready for Wharton's jelly. So what's Wharton's jelly? Well, it's a gelatinous substance. It's found in the umbilical cord. It comes from donated umbilical cord. They remove the umbilical artery. And it's rich in stem cells, growth factors, exosomes, all great stuff, making it a valuable regenerative medicine tool for tissue repair. You should know Wharton's jelly products are required to be assayed for various quality and safety parameters. These are all performed under the GMP, or Good Manufacturing Practices, for batch release. In addition, these products are screened for infectious diseases and contaminants. That includes the COVID-19 spike. It can create some immunoreactions that you might not want to have. This ensures safety for clinical use. Now, regulatory authorities, they expect comprehensive documentation and quality control, including certificates of analysis and batch records that verify that each lot meets the established standards. Now, Wharton's jelly products are classified as biologicals. Those are drugs. You must know that there are no FDA-approved versions that are currently available of Wharton's jelly. In the applications that are described in this program, you'll have to have documentation of patient-informed consent that the product is a non-FDA-approved investigational alternative. Let your patients know, no, this is not FDA approved. It's an alternative that we're using to keep you out of the pharmacological drug system that ends up in cortisone and knee replacement surgeries. So Wharton's Jelly bioscaff, you can see the tubes. They're little tiny tubes, 1 ml. The supravesical Wharton's Plus on the left and the bioscaff on the right. Wharton's Jelly, it's specialized connective tissue. It's composed primarily of mucopolysaccharides, collagen, proteoglycans, glycans, and various cell types, including, very importantly, abundant mesenchymal stem cells. So mesenchymal are undifferentiated cells. These cells actually differentiate into the cartilage-producing cells in the joint when they're entered there. It's embedded in a highly hydrated matrix, and it supports the umbilical cord. It contains approximately 40 million cells. Specialized Wharton's Jelly can actually be used for IV conditions, for IV therapy for systemic conditions like autoimmune disease. Tremendous impact there. And there's up to 100 million cells in IV Wharton's Jelly. Mixing the jelly with bioscaff, you're going to mix it 20 times back and forth for Wharton's Jelly. You can see it just moving back and forth from one syringe to the other there on the screen. And as I mentioned before, when we do any of these injections, we want to maintain sterile conditions throughout the injection process. Super, super important. I say you can never use too many surgical gloves when you're doing the procedure. This patient's an amazing guy, 75 years old. He's having his Wharton's Jelly procedure there. He was a former Army Ranger and is a flight attendant now for one of the major airlines. And he gives such a great testimonial about how important it is to be able to walk and to be able to go to the grocery store and go to church. And he lost his wife, and how important it is to him to be ambulatory. And he's in amazing shape. What a great guy. So I want to talk to you in closing about some powerful adjunctive therapies that you can help stack. Stacked therapies will help protect the cartilage greater, reverse the catabolic process. Remember, we're in catabolism, we're in breakdown. We want to shift that to anabolism, build up, right? We want to rebuild the structural integrity of the joints. And again, make that difference between wow and ow. Ozone, my goodness, I love Ozone. We use Ozone with every single joint injection procedure. We use it for trigger point injections, all kinds of things. It's put in the syringes in the joint. You unscrew the syringe. If you put PRP or you put A2M into the joint, needle stays in the joint. Unscrew the syringe, screw in the syringe with the prepared Ozone in there, and Ozone and then you hyperoxygenate that area. So valuable. An ozone generator that you see here on the screen and regulator to an O2 tank converts O2 to O3, adds the other oxygen molecule. Why is that important? Well, it reduces pain and inflammation. Ozone therapy is a powerful anti-inflammatory, and it also has analgesic properties. It accelerates healing and functional recovery. Ozone enhances oxygenation. Oxygen is required for healing. Stimulates cytokine production that supports faster and more effective tissue regeneration. It, in fact, enhances regenerative effects. Ozone activates and amplifies the effects of growth factors that are in PRP, A2M, and Wharton's Jelly, and that further stimulates stem cell activity and new tissue growth. It is a powerful plus for all of your joint injections procedures. And it's very low cost. The Ozone generator is less than $1,000. Tank of O2 lasts forever. And we include that as part of the packages that we deliver with any of these joint injection procedures. All right, let's do some more stacking. IV nutrition. Yeah, you see that on the right-hand side. And iontophoresis push patches. What are those? So we spoke about BPC 157, body protecting compound, NAD+, GHK-Cu. We didn't mention that, but that supports collagen production. We use push patches. They're iontophoresis patches. They promote angiogenesis, moderate cytokines. You'll do a loading dose 3 days in a row, typically on an area that doesn't have too much hair, up on your bicep. These can also be used for really and great, especially the NAD+ and BPC 157. low back pain, if you're doing discs for low back, disc decompression therapy, neuropathy, get it as close to the area. Put it right on the red hot back or down on the calf if you're treating neuropathy. The reason we use iontophoresis, it allows for a really slow sustained uptake of the body for 12 to 14 hours. It helps maintain the therapeutic dosage for significantly longer periods of time than injection of peptides. This is because peptides have a very short half-life. And if, for example, if you were injecting BPC 157, you might have to do that a couple of times a day. NAD plus done in IV drip, in order to get the same dosage that you would with the 3 patches, it's going to take you 4 hours sitting inside an IV drip nutrition chair. And boy, that is not fun. It's also really rough on your GI system. You get a lot of flushing. Not a cool procedure for NAD. Really great for other things that can support healing, Myers cocktail, etc. That's IV drip therapy. But I love the iontophoresis push patches. And these are something that can actually be dispensed by a chiropractor. You don't need to be a medical provider to dispense the push patches because we're not breaking the skin. Iontophoresis is in just about all states. So, quick conversation about peptide therapies. Also must be manufactured under the GMP standards, ensuring quality, purity, potency, sterility, stability. Remember, what you say is really important. That's regulated by the FTC, Federal Trade Commission, and it's very highly scrutinized when it comes to peptides, any marketing claims. If you're making claims about muscle growth, weight loss, therapeutic benefits, these can trigger regulatory action if the peptide's not FDA approved for those uses. They're often labeled for cosmetic use. This isn't going to exempt healthcare providers from enforcement action for if you're making therapeutic claims. So don't make claims. Here's a disclaimer that you can use on your advertising and website. Peptide therapies for educational and wellness purposes only. These products are not intended to diagnose, treat, cure, or prevent any disease. Individual results may vary. Now, the regulatory environment for peptides, man, is it dynamic. It's changing all the time. So with the ongoing changes in both federal and state levels, manufacturers, marketers, and you as the prescriber, and me as the consultant, have to stay informed and compliant to avoid any legal and professional risks. All right, here's a couple of post-injection adjunctives: PEMF therapy, post-hab, and functional med. So post-electromagnetic frequency therapy stimulates cellular repair because it increases ATP production in the mitochondria, helping improve circulation, reduce inflammation. Functional medicine is super important. We're dealing with chronic inflammation here. You want to identify the root cause of chronic inflammation. Could be coming from increased cortisol in the endocrine system. Could be coming from a leaky gut or the liver detox systems. Those should all be evaluated by a trained functional medicine professional. Studies show that when you combine Regen Med with a structural rehab program, either pre or post, it leads to faster healing and more complete recovery than Regen Med procedures alone. After a period of post-rest after the injection, the muscles around the joint can even weaken. And rehab focuses on progressive strengthening to rebuild muscle mass in joint, enhance joint stability, and prevent future injury. As I mentioned, don't forget to ask about our GPL group pricing organization. Breakthrough Coaching members who participate as Breakthrough Coaching members get discounts of up to 50% on the products and services that are featured in this program. All of our vendors and manufacturers are vetted for FDA and FTC compliance, and they undergo the regular required testing to ensure that they are in adherence to all required regulatory industry regulations. Well, I hope that you have enjoyed this presentation about bringing your Regen Med protocols to the next level. If you missed the first one, please go back and watch it. Be sure to watch it because it really tees up how we get to the process, how we select patients, making sure that we not only have the right substance, but we're injecting it in the right place. So This is Dr. Mark Sanna, CEO of Breakthrough Coaching, multidisciplinary coach for 30 years. And I am hoping that you make today an exceptional day. Thank you, as always, to ChiroSecure for making this program possible.